Good afternoon and welcome to our weekly COVID-19 update for the town of Plymouth. I'm Steve Triffletti, Plymouth Town Moderator. I'll be here each Wednesday at noon for this update, which is number 108. This forum is being brought to you today live by PAC TV. It's on Comcast Channel 15, and you can see it on Verizon Channel 47. You can also watch this on PAC TV's streaming channel by going to pactv.org/live. For questions during today's forum, please email us at plymouthinfo@pactv.org. These forums can be replayed at pactv.org/Plymouth. Today's participants joining me include State Representative for the town of Plymouth, Mathew Muratore, our Chair of the Board of Health, Barry Potvin, and also the Director of Health Services for Plymouth Public Schools, Carilyn. And at this time, we're going to begin with Dr. Barry Potvin. He is Professor Emeritus from Yeshiva University in the Department of Biology. Welcome, Barry.
Yes, thanks, Steve. It's a pleasure to be here again. So I'm going to go through as quickly as I can the usual sort of information that I try to share on these update shows. So I'm going to do that right away. So as is usual, here's the Plymouth average daily cases per 100,000 population over 14 days. I guess the good news is you can see way down at the far right-hand side, it looks like there has been at least a temporary leveling off of the increases that we see. This is as of yesterday at about 5 p.m. The current count of cases and deaths among everyone in the US and Massachusetts and the Commonwealth, and also in the town of Plymouth. I guess the good news is on the mortality rates, those really haven't changed. The bad news is that if you look at the number of deaths in the United States, believe it or not, it has now exceeded what happened in the flu pandemic in 1918, which is quite amazing considering that we do have effective vaccinations. You would hope that wouldn't have happened. Down at the very bottom, you can see we did record one additional death here in the town of Plymouth. So it's still ongoing. The numbers are still going up. In terms of what's going on in the Plymouth County hospitals, you can see that, again, perhaps things are leveling off a bit, but there were, as you can see on the top right-hand side, new admissions, which have leveled off, but they're still certainly above where they were in early July. There's also the same sort of thing going on with the number of beds used and the same sort of thing going on with the ICU beds. I saw this and it's really for the entire United States, but it caught my eye simply because if you look at these hospitalizations of people with confirmed COVID-19 in the United States, the peak is astonishing. It's way over here on the far right-hand side, and you can see that it's far worse than what happened this past May, but it does look like it has actually reached a peak and has started to slowly subside. If we look at what's going on here just in the Commonwealth of Massachusetts, you see it's nowhere near as severe. So it's a little bit below, just slightly below what happened in May and maybe late April. But again, it may be tapering off at the moment. Things have changed in the United States just a little bit. They still consider transmission very high in the United States. There's still a very concerning 7-day positivity rate and a very high 7-day case rate per 100,000. Remember, this is for the entire United States. What's new here is that California has finally become, at least for the moment, the only state which has substantial transmission as opposed to high. And Puerto Rico is also in the same category. Once again, if we look at the Commonwealth, you notice that all 13 counties in Massachusetts are still considered high risk for transmission by the CDC. Again, this obviously has a lot to do with the Delta variant. This is the observed and forecasted weekly COVID-19 cases in Plymouth County. Looks about the same as I showed you last week. It did go up, but you notice that the forecasted levels show now kind of a slight expected decrease. This is the new cases in the Commonwealth of Massachusetts, reported just yesterday by the CDC. And you can see that, once again in the state, it's just slightly below what was seen last May. There's a little bit of a dip here and there, but it's still showing a progressive increase. This is the CDC's risk criteria. Just calculated these actually this morning from the latest data. Notice that up here, high transmission risk is anytime you have more than 100 cases over 7 days per 100,000 population. Plymouth County is now 175.36, and Plymouth, which you have to calculate on your own, is 165.37. So we're still, unfortunately, well above the 100 criteria that causes high transmission risk. This is again the Commonwealth of Massachusetts. So you notice that concerning here is that there's been new COVID deaths per 100,000 that have gone up 53% since the past week. Otherwise, things have not gone up very much. The rate of new COVID cases per 100,000 has gone up 19%. Here is, I think Matt's going to talk about this more, but 76.5% of the total population in Massachusetts have gotten one dose of the vaccine, and 67% of the population has been totally vaccinated. These are the latest numbers, again, for what's going on in terms of fully vaccinated people in the United States, 54.4. Massachusetts, when this was done, was 67.8. Plymouth was 62%. Down in the bottom, you can see the positivity rate, which is the positive tests for all the tests being given. Town of Plymouth, that's 3.83%, and Plymouth County is 3.46%. Again, above the 3% level that Provincetown used to determine if they should put in place a mask mandate or just a mask advisory. Here's our latest vaccination data. And again, it shows you what's going on in terms of the total vaccinations for those who are eligible to get the vaccine, which still doesn't include those under the age of 12. The things that are most concerning are, although this number has gone up, which is the 1+ dose of vaccine for the 12 to 15-year age group, it is still 57% and only 49% are fully vaccinated. Those are our school age kids, some of them. The other group, 16 to 19 year of age, have done better. The 20 to 29-year-old group is 63% and only 56% fully vaccinated. And again, the 30 to 49-year age group is 62% fully vaccinated. So the ones I've underlined for you, again, are the ones that are considerably below the state average. So the 12 to 15-year age group here is about still 14% below. This one, the 20 to 29-year age group, is 9% below the state average. And this one, the 30 to 49-year age group, is still 14% below the state average. So we're doing a little better. There was 517 new shots given make sure people are becoming fully vaccinated. That's up from 230 or so from last week. So it almost doubled. And I'm hoping that that's a trend and we're getting more people vaccinated now simply because the summer's over and they have more time to take care of this. These are the updated data for people who are fully vaccinated but still came down with COVID. And you can see that it's gone up. This group accounts for 0.71% of fully vaccinated individuals becoming a positive case. Hospitalizations, it's 0.02%. And for deaths, it's 0.005%. So nothing new here. What's happening is that quite obviously, most of the people that are getting infected and are going into the hospital and especially are dying are those that have not been vaccinated or those who have not been fully vaccinated. So this is not changing, and that's a concern. I wanted to mention that just looking through the data from WBUR, 40 Massachusetts communities have enacted face mask mandates for both municipal buildings or offices and all indoor spaces, although the rules vary from one to the other somewhat. 47 additional communities, which include Plymouth, enacted face mandates or policies only for municipal buildings or offices. And for those that are curious, although this has not been updated since the end of August, the list is available at the website link that I show here. Oops. Finally, I just wanted to show this because a lot of people have asked questions about the monoclonal antibody treatments. So answer to these questions, this is sort of like what Mark Wilson does. Can monoclonal antibody treatment prevent or lessen COVID infections? And the answer is basically, as it mutates, monoclonal antibodies target the original form of the virus may become less helpful. But at the moment, they stop distribution of the antibodies, which are called these two names, after evidence showed they weren't as effective against the new variant of the virus. But other monoclonal antibodies remain helpful. Consumers should know that Regeneron monoclonal antibodies do work against the Delta variant. Is this different from a vaccine? Well, yes, it is. Vaccines stimulate your immune system to respond and make antibodies against the virus. Your immune system becomes ready to create these antibodies before they are needed. The monoclonal antibodies are made artificially. They boost the immune system after you're already sick, at least for the first week after you show symptoms. It speeds up your response to prevent it from getting worse. A vaccine does this much better and easier than the monoclonal antibody treatment. And the monoclonal antibodies don't stick around. They're effective for about a month and then they're completely gone. 6 months later, a vaccine offers much longer lasting protection. What do they cost? Monoclonal antibody treatment costs about $2,000 versus $20,000 for a vaccine shot. How is it administered? It has to be done in intravenous infusion overseen by a nurse over an hour and a half. Is it currently available? It's in very limited supply, given only to those in the very earliest stages of infection. And a lot of hospitals are having difficulty because of nursing shortages, assigning nurses who are needed for other patients in need of urgent care to do these monoclonal antibody infusions. So I thought everybody should know about that. I'm going to stop here and leave time for the other speakers and to answer questions at the end.
Thank you, and that's Dr. Barry Potvin. He is chair of the Plymouth Board of Health. He'll be available to answer your questions. At this time, we welcome back Carilyn Rains. She is the Director of Health Services at Plymouth Public Schools. Carilyn, welcome back, and what's happening with health at Plymouth Public Schools?
Okay, well, we have certainly had a very busy start to our school year this year. I really appreciate the opportunity to be part of the conversation today, so thank you. Normally the beginning of the school year is very busy just in terms of student record keeping and the nurses getting to know some of their new incoming students and students that have transferred from the elementary schools into the middle and from middle into high school. So it is normally busy, and I think that our decision to take part in the testing initiative offered by the Department of Education and Department of Public Health has proven to be certainly a busy initiative. We have been seeing some probably a little higher numbers of positives and close contacts in the school setting. So I think this school year, because all of the kids are back, trying to keep the learning as much back to normal as we can. And it's been great. We're still seeing, a lot of the students outside having lunch, having classes during PE time, which is, certainly great with this nice weather. We're taking advantage of it. So one of the big things I just really wanted to talk about to start was the Test and Stay initiative and the symptomatic testing. So with the Department of Ed and the Department of Public Health, they were offering 3 types of testing that we could have participated in this school year. The first one I want to mention that we opted not to participate in is the pool testing, which is basically the testing that it involves randomly selecting small groups of individuals, up to 20 people, asymptomatic, not close contacts, and just doing grouping the samples and doing a PCR test. And any of those do come back as positive, we would need to individually do rapid Binax testing on each individual person. We felt like based on the data that was provided from the last school year with schools that did participate in this testing, that it would be extremely time intensive. It would maybe interfere a little bit with the time on learning piece for us students, which is actually why our kids are here every day. So we felt like that, at least initially at the beginning of the school year, that was not one of our options. So the two that we did choose were the symptomatic testing. The symptomatic testing is supposed to be for students or staff who develop any type of illness or symptoms during the school day. So we're still really, really highly and strongly recommending that everybody not come into school in the morning when they're sick. I think families and staff are cognizant of the importance of that. I mean, I know this is a tough time. Historically, beginning of the school year, lots of kids get colds, allergy season. And it's really tough for families, I think, to discern, the differences sometimes, because we know that there are kids who come in with very mild symptoms who end up being diagnosed with COVID. So it's a little bit of a tricky game, but I think we've been, the nurses, because we have good communication with our families and staff, we really have a good sense of, how to proceed in terms of managing these kids. So again, if a student is sick or a staff member becomes ill during the school day, there are some symptoms that we would immediately send somebody home, like fever, respiratory issues. But there are some of the vague sore throats, light headache, that we would definitely have the student partake in the testing. If the Binax rapid test came back negative, the student would remain in school. And this has been good for some students and staff because, they have tested negative. So it's been fine. And obviously not missing out on the time on learning piece. The other testing option that we're participating in is a test and stay program. And it's a little unique in that it's obviously offering Binax testing to students who are asymptomatic in the school setting who have been identified as close contacts. And of course, the state has revamped and changed their updates and their guidance a little bit. A lot of the epidemiological guidance and advice we were given last year is out the window this year. So a lot of things are different. So a big learning curve for us in terms of who is eligible for testing. So for example, if we have a fully vaccinated student in middle school or high school, and they were deemed to be a close contact, either because they're sitting on masked in the classroom less than 3 feet apart, or at lunch less than 6 feet apart unmasked, those students would not be eligible for testing because they're fully vaccinated. If a student has had a history of COVID infection in the last 90 days, those students are also exempt from the test and stay program, but they're still able to come to school. So all the other kids, and again, this is certainly more indicative at the elementary level where vaccines have not been introduced yet into that age population. That we are seeing, some higher numbers of close contacts in the school setting. There are a significant number of families who have reached out to us after we sent out the letter, just for clarification on a number of points, just to be, which is great because we want to keep the lines of communication open around all of this and be transparent that this is just specifically in school close contact testing. In terms of kids who are, and there are still kids who, over a weekend, a parent will call and say that a child was around an adult or a friend who did end up testing positive, and those kids are not unfortunately eligible for the test and stay program. And the rationale for that really is that if you're in a classroom for the most part masked, eating lunch unmasked for a short period of time, and you're in contact with somebody who is diagnosed positive with COVID, the likelihood of infection is a lot less than if, say, for example, you're spending close contact in a car and in a home with another person who's positive. So the exposure is definitely a little bit more minimal in terms of length of time exposed, which is why I think if we were testing all close contacts in and out of the school setting, I think it would become a little bit too much for us. So again, this is just a specific program that the Department of Ed wants us to do for kids who are in the school setting. Again, we've been able to keep so many kids in school. Some of our schools, we may have up to 11, 15, 20 close contacts that we've deemed are eligible for the program. And for the most part, we have had a few kids test positive on Binax. But the majority of kids have been able to go back to class for the entire week, and it's been great. So we're really minimizing our quarantining. So the kids are definitely getting that advantage. The other piece with the new ruling is that if we have a positive Binax test, the epidemiologists have guided us in that if that family follows up with the primary care physician and is able to get a negative PCR test within 48 hours of the positive Binax test, then that trumps the negative PCR trumps the Binax positive, and they can return. So we're not necessarily waiting and seeing a lot of kids having to stay out until after day 7, which is, again, time on learning is definitely more positively impacted in that area as well. So again, we are seeing numbers more than we had hoped for. We did put our dashboard back in place last week, which is something, again, we want to be transparent. We've minimized the data that we're putting on the dashboard because we're doing basically mirroring what the Department of Education is doing on a statewide level. So we're just reporting the positive cases that we're having. We're not looking at the numbers of those contacts. We're not looking at who's quarantining every week. That's a little bit more, it's a little more limited, but it's still giving out some good information. And we do have some more positive numbers, and we are reporting numbers on Tuesday now as opposed to Friday, because again, we're trying to mirror exactly the practice of the Department of Education and what they're doing. So the superintendent and assistant superintendent of human resources will be inputting student and staff numbers in later this afternoon today for positive cases. I think that, again, one of the bigger pieces is the best thing we can do is continue to stress the importance of communication with not just our families and students, but with our staff. Really, again, encouraging the mitigation strategies that are in place with proper mask wearing, hand washing, distancing when possible. I think that that's critical. Another thing that we're doing now too is looking at getting the vaccine documentation from our staff. Again, the state is not requiring this, but it's a voluntary practice. So we have reached out to our school community, our families, asking if they will voluntarily share their children's vaccination status with us. We do have a state MIIS system where we can log on, although not all of those are actually in there, depending upon where the kids received their vaccine. Normally, primary care practices will document all vaccine administration into this mass info management system, and which has made it very helpful for our health offices to keep up on immunization data. But with the COVID vaccine, depending upon where the vaccine was administered at some of these larger test sites, we may not have that as accurate as we would like it to be. So staff and students are sharing this information with us and it's rolling in slowly but surely. The Department of Ed wants us to look on October 1st and has said that if a school building, not a district, but a school building individually has a minimum of 80% of the individuals in that building during the school day vaccinated, fully vaccinated, then the masks can come off, at least with the vaccinated people. So I'm not really sure. I know it's with the middle schools, we do have a large number of kids who are under 12. So I'm not really sure how this is going to look across the district. And we probably, again, the Department of Ed and DPH is constantly updating guidance and coming up with new plans and strategies. So as the school year progresses, we'll be looking at those things in terms of how we implement the masks in the school. And I think pretty much that is all I have to report right now. If anybody has any questions, please feel free to ask.
Thank you, Carilyn Rains, and we do have questions. She's the Director of Public Health Services at Plymouth Public Schools. This time, we're going to go back now to Plymouth State Representative Mathew Muratore. Matt, what do you have from us from the state for this week?
Steve, I will be quick in order of time here. Just to reiterate the vaccine status, there have been over 10,600,000 vaccinations delivered to the Commonwealth since this vaccination started. We have 9.4 million people have been vaccinated, with 4.8 of them with the first shot. And total vaccinations, as Dr. Potvin said, is 4,591,000. We will hit 4.6 million by the end of this week of fully vaccinated, which will be about 68% of the eligible population that will be vaccinated. But we will probably see, probably by November, probably about 75% of the population actually vaccinated here in the Commonwealth. And one other note I do want to say is that the 7-day positive test rate has gone down. Last week it was 2.28, it's now 2.1%. So again, it's gone slightly down, nowhere near where we were back in the spring of 2020 at 30%, but So all indications are the vaccination is working. As Dr. Potvin said, the majority, there are people that are vaccinated that actually are hospitalized, but the majority of people that are being hospitalized are those that are unvaccinated. And that's the update from the state, Steve.
Thank you. And at this time, we're going to go to questions for our panel. We're going to begin with Dr. Potvin. And Dr. Potvin, 2 questions regarding vaccines for children. First, how long will the rollout take for ages 5 to 11, the vaccines to get to the public? And second, will people be able to opt their child out of the vaccine, ages 5 to 11? Dr. Potvin.
Okay, Steve, well, of course, this is somewhat unknown because it's still in the process of being reviewed by committees and by the FDA. The last I heard was they were hoping that the vaccine may be approved for emergency use for the younger kids, 5 to 11, perhaps by the end of October at the very earliest. But this is, of course, really still unknown. In terms of opting out, I would assume, well, first of all, the vaccine they've actually tested for the younger kids is given at 1/3 the dose that they usually give to adults. But in terms of opt-outs, I would assume that it would be treated the same fashion that any vaccination is treated with regardless of age, which means that if there's a medical reason for opting out, of course, that would be respected. And some, but not all states also consider personal or religious exemptions for the vaccination. Also for students that are in school, that's going to be partly up to DESE, I'm sure, and also the governor. So that's all I can tell you about that at the moment because it's still a work in progress.
Thank you. We're going to go back to Carilyn Rains. Carilyn, a question from viewer Christine. Will Plymouth schools meet the 80% threshold for students to be vaccinated by October 1, or will masks still be required after October 1?
You know what, that all actually depends on how our numbers look when we finish looking at all of the documentation that we've been receiving from families. So it's really unclear at this time to even make a prediction on that. One of the other things I did want to share is that the Department of Public Health did come out at the end of the summer and already shared that the flu vaccine and the COVID vaccine for children, it was not going to be required for school entry this year. So there really isn't a situation where parents have the opportunity to opt out right now, because the vaccines are not required for being in school, either the flu or, of course, the schedule of other vaccines is still in place. There were some new additional vaccines added, but that did not include the flu or the COVID vaccine.
And one additional question, will parents get to hear what percentage of families opted out of COVID testing in school and by location?
You know, I'm not really sure what specific information that the superintendent is going to be sharing with the school committee. I'm sure if that is a question and that the public or the school committee would like to see the numbers on that. You know, and I think right now from what we've seen, again, we're just looking at situations where parents are just getting on board with this. I mean, this initiative was just really rolled out last week. So we're very new in the process. Families may be waiting to see if their child is identified as a close contact or not before they decide. And they do have questions. A lot of them have some very thoughtful questions that they've reached out and asked us. So again, I'm hoping that if anybody is hesitant to participate in this particular initiative, that they do reach out to their school nurse or to myself or to the superintendent's office, just because we want people to be able to make fully informed decisions. Again, so I don't know that we're going to have specific numbers. I think right now they'd be a little skewed and not accurate, and that many families may just be waiting to see if this, impacts their child or not before they sign up.
Thank you. And that completes the questions and completes today's presentation. We want to thank Dr. Barry Potvin, Chair of the Plymouth Board of Health, also Carilyn Rains, Director of Health Services at Plymouth Public Schools. And of course, each week we're here with Plymouth State Representative Mathew Muratore. Next week we'll be joined by Dr. Philip Triffletti. He's an attending primary care physician at Beth Israel Deaconess. We will have one additional panelist joining Representative Muratore and me. I'm Steve Triffletti, Plymouth Town Moderator. Thank you for joining us and good day.